First, I should like to thank the organizer for inviting me to this very beautiful city. It's a pleasure to be here. And I want to talk about human biomonitoring approaches which you can use to detect cancer. The situation is problematic still. Many people get cancer. 1 out of 3 people is diagnosed during his life with cancer, and still the therapy is not as good as we would like. If you just focus on the white bars, you see the black bars represent mortality rates in males and humans, in females, and there is always shown a time between 1990 and 2006. The treatment success is there, but it's not tremendous. So that indicates prevention is still much better than therapy, and much less money is spent for the prevention strategies, and much more money goes into the development of new drugs. So I'm working all my life in prevention and never worked in therapy, and it's interesting that about 1/3 of preventable causes of cancer is due to wrong nutrition, 30% smoking, and the rest due to many other factors. A very important factor is lifestyle and occupational exposures. This is a very classic, very old plot, but still was confirmed in several subsequent analyses. And what do epidemiologists do? They either look into the future or they look into the past. Retrospective studies are based on visits of cancer patients, and they are asked, what did you eat maybe 20 years ago? And the problem is nobody remembers correctly. If you look into the future, you can write that down, how much is consumed, but you will have to wait 20 to 30 years till people get cancer, and you have to involve a large number of individuals, because rare cancers are 1 in 1,000, so for rare cancers you need a large population. The best study for nutrition was the EPIC study, which is realized the European Prospective Investigation on Cancer. It's a joint effort of 24 individual countries going on over 2 to 3 decades. So this you will find in the literature. Now here you see that instead of these costly studies, other approaches were developed. They are based on human biomonitoring, and we can look at DNA damage, which is probably the most important factor leading to cancer. So we can look at chromosome damage, at gene mutations, oxidative DNA damage, and so on in humans, in exposed groups. And if you have a positive result, there is a very high probability that you detected a risk group. And this is what we did. And I want to show you 2 different methods. One method is the COMET assay, very simple, based on electrophoresis, on DNA migration in an electric field. The second approach is based on the detection of chromosomal damage. And you can perform these experiments with peripheral lymphocytes of humans, also with other types of cells, and you can use these methods to look for occupational or lifestyle or nutritional effects. The COMET assay is called COMET assay because what you see under a microscope are comets, like the comets you see in the sky. When the DNA migrates, when it is damaged, it migrates in an electric field, and you have these comet-like images, whereas intact DNA looks like an orange. The nucleus is intact, no DNA is migrating out of the nucleus. With this very simple technique, it works like that. You collect the blood, you isolate the nuclei from the cells, and then you can either do the cell migration under standard conditions. So that is single and double strand breaks, what you measure. But you can also treat the cells with enzymes which recognize oxidized bases. Then you get information of oxidation of DNA, for example, by ionizing radiation, stress, reactive oxygen species. And another procedure, you can measure the influence of any factor on repair processes. We have two different important forms of repair: base excision and nucleotide excision repair. But the most important is the standard protocol. Okay, so you put the cells then into you take out the nuclei, you are staining the nuclei, you are using alkaline incubation to make single-stranded DNA, and then you put the cells, which are on the nuclei, which are on slides, in an electrophoresis tank under standard conditions, and then you measure comet formation. Usually we use a computer-aided program. Very simple. Very simple also, the determination of micronuclei. Micronuclei are nothing more than broken chromosomes or entire chromosomes which are not integrated in the nucleus. They stay outside of the nucleus. You look into a microscope, you see the main nucleus and sometimes a micronucleus. This is much better than the conventional chromosome analysis, because in the old days we were looking at individual chromosomes, so it takes a very long time to look if there is a chromosome break or aneuploidy or clastogenic effect when you do chromosome analysis. So this is a much simpler technique developed by a close friend, Michael Fenech in Australia. Okay, you can, apart from the micronuclei, you can look at many other nuclear anomalies. They tell you about acute toxicity. If the cell is dying, you can look for apoptosis, for acute cell death, and many more. But micronuclei are always the most important, they are the most important parameter. So this shows you again how we do the micronucleus assay. We collect from the lymphocytes of people, and then we treat with cytokalasin B, and we score in binucleated cells, because the micronuclei are only formed when the cell is dividing. And to measure, to see if a cell has divided or not, we are using this cytokalasin B. And we are looking for many nuclear anomalies, but as I said before, most important is just the micronucleus formation itself. Other events are also related to cancer, but I don't want to go into details. Alternatively, we can also collect cells from the mouth or from the nose. And this is even much simpler. We just use a toothbrush. And so we could sample in some remote areas, like in the mountains of the Andes in Peru, in Ethiopia. I was on many places. We sampled cells from people from the mouth. It's much more complicated to get cells from the blood, but these are very elegant and simple techniques, and can be realized. Again, we look for micronuclei and other nuclear anomalies. And so I hope we can do that in the frame of a planned collaboration with Ukraine. And we can look at diseases, occupational exposures, radiation effects, environmental pollution, nutritional effects, lifestyle factors. Many, many areas of research. And I want to give you just a short overview what we did at the Institute of Cancer Research in Vienna, where I worked for the last 35 years, I guess. In the nutrition studies that we did were recently focused on obesity. I always thought chemicals are very dangerous. And so we looked at many chemicals in the environment. Now, people become more and more obese. 40% of the Austrian population have a not normal BMI. More than 10% have adipositas, and that's a worldwide process. It's a pandemic also, and obesity is increasing everywhere in most countries, and it has an effect on DNA, And it also has a strong effect on cancer. Obesity is one of the most important cancer reasons nowadays, and it affects many different organs. As you can see, this is the BMI and the the relative risk factors. For example, in the males, the liver is highly increased, in the females, uterus, but many other organs are affected. And then 3 years ago, I wrote a very complicated review about the mechanisms, how obesity makes cancer. Whenever you eat anything sweet and your glucose level goes up, you have radicals in your body, oxidative radicals. That's one reason, but people who are obese, the fat tissue is attacked by the immune system. And as a consequence, you will have a persisting inflammatory status. And this leads to DNA damage. Now, first of all, we did animal studies, and we were feeding mice with a high-fat diet, Western diet. They become really fat, like tennis balls. And then we made a weight loss strategy. The message I want to give you is, we see in these obese animals, in all organs, a lot of DNA damage, a lot of oxidative DNA damage. So I'm talking today about human effects, not about mouse experiments, but I always said, Chernobyl or Sacher cake, the effects are the same. Because whenever you have radiation, you have DNA damage in many inner organs. And whenever you have obesity, you have DNA damage in many inner organs. And the reason is formation of oxidative radicals, of reactive radicals. Now, what happens if you lose weight? That's what we studied in a group of bariatric patients. After 6 months, we see that the extent of comet formation is going down, and also the repair capacity is going down. That was unexpected, but the repair is going down because it's not needed. It is down-regulated when it's only going up when there is DNA damage. When there is no DNA damage, the body is regulating down the DNA repair. So that's our latest finding. And then we did many individual food components. We discovered that coffee is making a very nice protective effect. That was good for the coffee industry, which funded us and developed a new type of coffee which is on the market. We see a protective effect with gallic acid, a very simple phenolic in some spices. Also with one beer component, we see a protective effect. So they started now to make beer without alcohol, but with a high xanthohumol content. So we see in a human intervention study, we gave this xanthohumol, which is in the hops, in the flowers. We see a very nice protective effect in an intervention trial already after 5 days. The extent of oxidized DNA bases goes down. So that's just an example for the nutritional studies and the lifestyle studies, of course. Of course, we know that tobacco smoking is dangerous, and we found, and that's interesting, it's not the nicotine. It's the tar, but the nicotine rather protective than anything else, because high nicotine cigarettes have lower DNA damage than low nicotine cigarettes. So it's the tar which makes the danger. And just to give you an overview, we are all over the world. Betel is chewed, and in India, and khat is chewed in Arabian countries, and in coca leaves are chewed in South America, and we did a number of studies with these chewers. In countries of the Horn of Africa, people chew khat, containing khatain, which is a natural amphetamine. It's the basis of many designer drugs which are used nowadays. So they are chewing this material. They become, after 20 years of chewing, you see the cheeks are very wide. And we scratched out their mouth cells, and we saw the more they chew, the more damage, the more micronuclei in this case. the effect goes up with the amount chewed, and in these areas you have a high prevalence of mouse cancer. So we could explain this high prevalence of oral cancer by this cut chewing habit. Now, occupational studies, we did a lot, and others did also a lot of studies, and we just published a booklet in Mutation Research Reviews together with Michael Fernech and Armin Nersesian. Many studies, not all of them successful, electroplaters, not negative, welders positive, many positive studies, no effects in workers of power plant, which is using methane from animal excreta, moderate effects in carpenters, which are exposed to formaldehyde, and our latest study were road markers. 2 years or 3 years ago, we studied these sprayers who spray the white stripes on the streets. This was never studied before, and we discovered a very strong effect. The reason is probably this is the effect in the nose and in the mouth. We see the micronucleus rates are strongly increased. The same thing here in the nose. Nose is a little bit problematic. It's a little painful, and you need a good doctor who collects the cells for you, otopharyngologist. And so what we saw is a dramatic effect, and we discovered a new group of cancer, occupational cancer, probably. The reason is that the reflector pearls are silica crystals, which are shining when you go with your car over the stripe. It shines up, and this is glass particles, which contain silica particles, which also cause silicosis and lung cancer. The last one is, can we directly use it in the clinical setting for the diagnosis and prediction of certain forms of cancer? Yes, we can. Stefano Bonassi is an Italian statistician, and he said micronucleus rates correlate with human cancer. Very clear predictor in the lymphocytes. That's what we know. We don't know that for comet assay, but that's a very, very solid study. Buccal cells correlate very well with the lymphocyte micronucleus rates, so very likely that they are also predictive. And then we can also correlate increased rates with specific diseases like bladder cancer and cervical cancer. Now that's bladder, epithelium in the bladder. In the urine, you can collect the cells by centrifugation and look for micronuclei. There is some evidence that you can use the technique for the not only for the detection of urothelial cancer, but also for the surveillance of patients, which is extremely expensive. Urothelial bladder cancer is one of the very expensive cancers, because you have to check the patient after the therapy regularly, and that costs a lot of money. And some patients die because of the repeated anesthesia. So that may be a useful strategy. Recently, we work also with the cervical cancer micronuclei, which you can easily score on the PARP smears that are routinely done to detect cervical cancer. And those of you who are in the field will know there is a number of pre-neoplastic lesions, and the pre-neoplastic lesions are indicative for a certain degree of cancer risk. And then you have cancer itself in the cervix, and you have different stages, 1, 2, 3, and so on. And the interesting, so there is a lot of studies available. Also, we made some studies. This is cancer. The other one before was a specific form of atypical cells. So there's more than one type of atypical cells. And this is important. The micronucleus rates go up with the malignant transformation of the cell. The higher the cancer risk, the higher the micronucleus frequency. And that was, of course, very interesting for us, because based on these analysis, which took us, I think, 4 years, to compile and evaluate all the literature, we can say micronucleus scoring is very likely an additional diagnostic tool to identify individuals which are at increased risk for cancer. Okay, so what I tried to do is to convince you that we can use these relatively simple approaches. They are not very costly. They cost some manpower, but you don't need a fancy laboratory equipment. You can also use automated scoring devices for COMET and for micronuclei if you can afford. They are not so expensive, so you can automatize this analysis. And they are very, very useful tools to identify population groups which have increased cancer risks. In Austria and many other countries, the most important strategy to identify, to look at workplaces is the measurement of individual chemical concentrations. And this is important, of course. But people are exposed to combinations of different chemicals. And you cannot predict these effects, these synergistic effects, just by looking at 1 or 2 or 5 chemicals. And therefore, these approaches they would complement the chemical measurements. Yeah? So this is what I wanted to tell you. Thank you for the attention.
Thank you so much, Professor Zigfried. Thank you for such brightful and exciting presentation, really. So now, time for question, please.
Thank you. I'm a second-year student of a medical university, and I would like to ask a question. And if I'm not wrong, you mentioned that DNA repair level is increased when an individual is exposed to factor risks. And my question is it possible to somehow preserve this increased DNA repair level?
Sebastian, very poor answer. People have been looking for these repair inducers in the diet. We have some compounds, we know that they increase the DNA repair. But many of these compounds later on turned out that they are dangerous, because the body obviously is reacting and inducing repair as a consequence when it is needed. I think it's an energetic problem. If you need a lot of energy to maintain a high repair capacity, it costs a lot of energy. So like the detoxifying enzymes in our liver, they are only induced when they are needed. Yeah, and not a priori, a high level would cost a lot of energy. That's possibly an explanation.
Else one question.
Actually, I can hear you well.
Who is involved in cervical cancer prevention, I was excited with your data about LCIL, low-grade lesion. We are looking for the surrogate markers of future progression of low-grade lesions. So I have a very practical question. What is particular method of micronuclear investigation in the squamous cells?
Well, when you do the PARP smear analysis.
In liquid, I think, method,
yeah,
yes?
okay. Many laboratories do the PARP assay. Papa Nicolau staining is not the ideal stain. It can be used for micronucleus scoring.
And which one staining would be better?
We think that a better stain are DNA-specific stains like Feugenfast cream. So that would mean if you can do this micronucleus scoring on PARP stain slides already. That would be also good, but eventually you make another slide where you stain with fast screen. And then you just go to the microscope and you score. That's very simple. The scoring needs some training. Yeah? There is some training required, but that can be learned in a relatively short time period, so to say. If you only look at micronuclei, it's very easy. If you want other markers, which we regularly do, this is more complicated. But micronuclei, we had a comparison of different laboratories. Almost everybody can see and identify micronuclei. Yeah, that is easy. And I can offer training for that also. I mean, this can be learned. If only micronuclei can be learned in 5 to 7 days, I would say. Yeah.
Thank you very much.
Thank you. Professor Knasmuller, in these studies, which obviously encompass large samples, and to make this a prospective study and a study utilizing a large population, have you or your laboratory put into effect or starting to think about using artificial intelligence in the interpretation of your studies in order to facilitate speed and accuracy in the results?
Yeah. The number of, we are just about to publish now, probably in 1 or 2 months, a paper which concerns the critical steps and also how many people should be involved in a study. It's not so many. Yeah, it's not. It depends on the size of the effect, of course. I mean, the stronger the effect, the less people you need to get a clear answer. Our estimate is an ideal group size, minimum group size, I would say, is around 50 individuals per group. Yeah, but higher numbers is much better. And there have been many attempts to automatize this approach by using of different strategies. The micronucleus assay attempts were made to use cell sorters to make a high throughput analysis, but there were also other attempts from Imstar, for example, from a French company, to develop a system which is automated screening microscopic analysis. So I think there is up to 10 different systems on the market for automated screening of micronuclei. And also the COMET assay automated versions are available at the moment, which increase the throughput. Yeah? If you do an experiment every 2 months, a study, yeah, and it's not so big, it's maybe not worth to buy these facilities, but if you do it on a routine basis, it's worth to invest some money in that. So that's what I know about this automatization. There is many papers about this, and I'm not really an expert in this. Artificial intelligence, I'm not aware of any serious bigger efforts in this field.
Thank you. Another question. Welcome.
Sehr geehrter Herr Professor Knasmuller, I'll speak in English. As I'm a neurosurgical resident right now at present, so I'm interested in the field of neurosurgery and neuro-oncology. So my question is, do you have the results of another studies for the use of biomonitoring approaches for detection of risks for neuro-oncological diseases? I mean, changes in glial cells and so on. Do you have such experience, and what do you think about that?
No, I cannot give you a good answer. It's not really where I'm working, yeah, in neurological disorders. I know that micronuclei in Alzheimer patients are higher. There is just a new special issue came out already in mutation research review section, and I think there is 1 or 2 contributions about that. But I can send you these papers if you want.
Dankeschön. Thank you.
Last questions, please. No question. I just would like to add that after such presentation, we should to start to think how to organize comet assay laboratory in our university, because it's very applicable method and really interesting, and results are very, very, very exciting. So
please do that as soon as possible. And it's not only me. There is the so-called H-Comet group, and it was a coordinated action supported by the European Research Council. It was a big cost action called H-Comet, standing for Human Comet. And this comet group, the action ended last year, but the group still exists, and there is a comet network and a lot of experts, and they are exchanging information and answering questions. So I will be happy to put you on this network, and I think we are helping together as good as we can. Yeah.
thank you so much again. Thank you so